everyone, and welcome back to another live session with us. Thank you for joining us. I hope everybody is doing well. For today's topic, it will be obstructive sleep apnea and women. Since Sunday is Mother's Day, here's a reminder for all fathers. We thought it would be timely to discuss sleep and women. But today's live is very special because we have a special guest with us today. We have Dr. Claude Poirier. Hello, Dr. Claude Poirier. How are you?
Hi, Rizalian. I'm fine, thank you.
So Dr. Poirier is a respirologist at Pierre Legardeur Hospital. He's also Director of Professional Development of the Quebec Association of Respirologists. As such, he's done frequent speaking sessions at conferences and workshops, as well as an organizer. Dr. Poirier is also a director of Centre Inspiré here in Montreal, which is a pulmonary rehabilitation facility. And more importantly for us, Dr. Poirier is our medical director here at Apnea Santé for now 12 years. So hi again, Dr. Poirier.
Hi.
So Dr. Poirier is here with us to answer some questions regarding women and sleep apnea. So let's get started, Dr. Poirier. So when I see female patients, I sense a lot of hesitation when I'm in consultation as a respiratory therapist. So tell us, Dr. Poirier, does sleep apnea also affect women?
I would say that the answer is, of course, yes. And as a clinician, we see more and more female patients looking for sleep apnea treatment. So, of course, female patients can suffer sleep apnea. But for many years, we had maybe misdiagnosis or underestimation of of sleep apnea in women, because as maybe we have time to talk about symptoms and signs of sleep apnea, but sometimes it's more difficult. It's a challenge to make the correct diagnosis of sleep apnea in female patients. That's why in the general population, actually we have 3 male patients for 1 female patient with sleep apnea. But this could change for the next years.
Okay, so you say it's underdiagnosed. Is it because there's a difference in the clinical presentation of sleep apnea in women?
Yeah, absolutely. Yeah. Often family physician will use scales, in fact, sleepiness scale, the Epworth scale, to find sleep apnea in their male and female patients. These scales are easily available on the web also. Anyway, it has been shown that with the sleepiness scale, a result higher than 10 is inappropriate sleepiness, daytime sleepiness. But it has been shown that female patients will have symptoms of sleepiness and fatigue, but will score lower on these scales than male patients. So sometimes family physician will not recognize the opportunity to investigate for sleep apnea. Also, female patients will come to the family physicians with atypical symptom. So not sleepiness by itself, but sometimes with fatigue, or sometimes with insomnia, restless legs, palpitations, nightmares, anxiety, and depression symptoms. And of course, in these situations, family physician will investigate for many other diseases. So many other tests would be asked by the family physician. And of course, the diagnosis of sleep apnea will be retarded, will be delayed.
Okay.
Another point is, maybe it's going to change with time, and maybe it's already the point, but anyway, for the last years, women were less likely to report snoring. Maybe snoring is less unladylike, so it was less reported than with men. And women will also attend the clinical appointment by their own, and more often men will come to the appointment with their partner, and the partner is able to report the snoring in these sleep apnea patients. So it's many challenges between the family physician and the female patient that will finally delay the diagnosis, or sometimes underestimate the, the prevalence of sleep apnea in female patients.
That's really interesting, Dr. Poirier, and I see that. I see how women tend to underestimate their symptoms. Now let's talk about the famous menopause. I can't relate. I'm not there yet, but is there an impact on sleep apnea with menopause?
I will tell you something, Rosalind. I'm not there yet, too.
Either.
So I'm not an expert of that for many reasons. But we know that as age increases, the prevalence of sleep apnea will increase also in female patients. We think that female sex hormones have a kind of protective role by the effect on the upper airway patency and the respiratory drive that comes with. We now know that progesterone has an impact on the respiratory drive. So it's another point is that after the menopause, women will have a higher fat mass when compared with the period prior to menopause, and the fat distribution is more likely to be in the upper body and the trunk, and less in the lower body. So these factors can explain why we will more likely see postmenopausal women with sleep apnea.
Interesting. And lastly, Dr. Poirier, before last question, are there other diseases that family doctors should look into with women with sleep apnea?
For sure. As I said, sleep apnea and snoring have been disorders of male patients for many years, mostly at the beginning of all that story of sleep apnea. So many years ago. Of course, the clinical studies have been done mostly with men, but more recently, in the last years, studies have shown that comorbidities, it means diseases associated with sleep apnea, occur also with female patients. We talk about cardiovascular diseases, high blood pressure, heart problems. We talk about arrhythmias, atrial fibrillation, by example. We talk about thyroid problems, asthma, joint problems. And in fact, it not only occur at the same time with female patients, but it could interact together. To give an example, if you address correctly, if you fix correctly the treatment of sleep apnea, you will have a positive impact on the treatment of asthma, and you will better control asthma symptoms on female patients. It's true for male patients also, anyway. So these diseases not only exist at the same time that sleep apnea, but they interact together. So the family physician should look to other diseases at the same time when they have finally the diagnosis of sleep apnea.
It's interesting how you say that it has a positive impact on the other diseases. But earlier, I just have a side question. You said delayed diagnosis in women. So the longer we wait for diagnosis, does that make the other disease more severe?
Potentially, yes, potentially. And we have not talked a lot about anxiety and depression, but these disorders coexist and interact with sleep apnea. And sometimes, unfortunately, we meet female patients that have been that developed anxiety and depressions in the last years without knowing why. And now they unfortunately they have a kind of burnout and they cannot go to work anymore for a certain period of time. So yeah, the delay sometimes will make the other diseases more severe or more pronounced.
Okay. And our last question is the management or care for sleep apnea in women same as it is in men?
So of course, it's a good question. We don't have a lot of studies done specifically about surgeries or orthosis and sleep apnea female patients. Um, we, we more recently we had studies done on CPAP devices, on CPAP treatment, and female patients, and it has been shown well. It has been well shown that the CPAP devices are appropriate to on many they have many positive effects on the symptoms, the daytime functioning, the activity level, the daytime sleepiness, the mood, the mood disturbances. And recently, more recently, a study showed that cardiovascular effect is well influenced by CPAP device on female patients. So the CPAP will lower the incidence of high blood pressure, arrhythmias, heart problems in female patients. So yes, we have good data now showing that the treatment is similar in men and women, but as effective also in female than in male patients. Some small difference have been observed on the pressures used to control the breathing stops, the apneas, but it doesn't have any impact on the treatment. And finally, the interfaces, the masks are about the same in female and male patients in the studies. So no great difference, but it's great to know that we have an effective treatment to offer to female patients, as we had no for male patients for many years.
That's good news. That's really good news.
Yes.
So that's all of our questions, Dr. Poirier. Thank you very much for taking the time to answer our question. That definitely enlightened me. I hope it enlightened some of our viewers, especially our female viewers. So thank you very much, Dr. Poirier, for sitting with us. For those who just
Welcome.
joined,
It was a pleasure. Thank you. It was a pleasure.
Thank you very much. Have a good day and hope to have you again soon. So for those who joined a little bit later, that was Dr. Poirier with us, joining us for a quick interview. Our topic was sleep apnea and women. We thought it was timely to go over this topic since Mother's Day is right around the corner. So just to recap briefly, sleep apnea is also something that women experience. And unfortunately, it's underdiagnosed in a lot of times. Because women tend to underestimate our symptoms, but also because of cross symptoms between sleep apnea and other sleep disorders or other diseases. So earlier we were talking that there are solutions for women who are feeling tired. So this is your sign, for female viewers or female patients. If you recognize yourself in that interview with Dr. Poirier, or if you find yourself with chronic fatigue, morning headaches, lack of concentration or memory, or daytime sleepiness, snoring, or insomnia, this is your sign to go get tested, or at least discuss it with your family doctor. It's okay to feel tired, it's okay to feel exhausted, but there are solutions for that. As moms, you want to have the energy to do your role as a mom, to run around with your kids. So to get diagnosed, it's very simple. Simply discuss this with your family doctor. As a sleep clinic, one of our services is to diagnose sleep apnea. So to get that process started, all you need is a referral from your family doctor. Come see us. We'll book you a half-hour appointment with a respiratory therapist like myself. I'm in Vaudreuil if you want to come see me in Vaudreuil. So we sit down with you, we discuss your symptoms, your past medical history, and then we send you off that same night with a device that records your sleep pattern. And with that, we are able to do a diagnosis. Once we have the diagnosis, you are scheduled to meet with a respirologist, just like Dr. Poirier. They are the expert in sleep apnea, where they will discuss in detail your sleep architecture and your diagnosis. And if it's not sleep apnea, there are still solutions that the doctors will discuss with you. So for our female patients out there, especially to our moms, please, this is your sign. Come and get tested. We're more than happy to see you. So please come and see us. So for this pretty much ends our live session, but I do want to give you guys a heads up. We will have another live session this afternoon. Kim will cover an experience, we'll cover another interview with one of our patients, one of our coworkers actually, who lived this whole process from going through the diagnosis to being treated, and she wants to discuss this to you in detail because we want to reach out to the women out there. Like Dr. Poirier explained, it's underdiagnosed in women. So we're trying to reach out. We're here to help you. So let us help you. So I hope this was helpful to everyone out there. We are wishing all moms out there a happy Mother's Day in advance. We hope that you guys have a good weekend. Get spoiled because you deserve it. So again, happy Mother's Day out there and have a good day. Bye-bye.